I am Sathish Magge, one of the cardiologists. I've been with Trinity, practicing medicine and cardiology for the last 29 years. I do general cardiology, interventional cardiology, nuclear cardiology, vascular surgeries with interventions basically, and also pacemakers. When I was growing up, my father used to be a social worker. I become passionate and emotional when I think about it. He sacrificed his entire life for indigenous people. And in our village, we did not have a hospital. And with the help of the government, he got the hospital there. But even today, for any kind of major surgeries related to the heart, particularly people with heart attacks needing interventions, they have to be sent out to bigger places. And when I was growing up and then when I went to the medical school, seeing all these things, I decided, cardiology is a great field. I can make a difference in patients' lives, people's lives. And also, we can save a patient, not just bringing them back to life and to improve their quality of life. That is the one reason after my medicine, when I did do a postdoctoral fellowship with rheumatology, and nothing wrong with rheumatology, and I had an opportunity to continue my rheumatology field. I wanted to see a specialty where can I really make an immediate difference in patients, and that's what I chose, and that's how I've been practicing, and it's really, really been fruitful up till now, and I enjoy with what I do. Exactly, every system in the body is important, but the kicker, the driver is the heart. And if the heart is not good or great, however good your other systems are, they will be up to the mark. So, to keep the heart strong and healthy, you have to take care of the preventive aspects of significant problems in the heart, where there is lifestyle modification, controlling the high blood pressure, controlling the diabetes, not smoking, watching your body weights with the daily activities. If you do all those things to prevent major things that can occur to the heart, you can prevent a lot of stuff. But even doing so, sometimes with a family history you cannot do anything about, and some of the risk factors, however you control it, sometimes you cannot avoid things happening with heart attacks and stuff. So the way we act immediately, take care of that to prevent damage to the heart, that will help. However, it doesn't matter how many heart attacks you have, how many surgeries you have, as long as the pump of the heart is well maintained and taken care, you will be normal like anybody else. So that is the goal of acting fast and taking care of it. And that's an interventional cardiologist can do. Unfortunately, women seek medical opinion late. That is the reason below 70 years or even below 60 years, below the menopausal time, the men's disease in men is much higher, but now it has caught up, and after 60, after the menopause, it's almost the same as men. Women go to the doctors late. Not only that, they have many atypical symptoms, which they say, it's not my heart, it's my stomach. They can present, particularly if they are diabetic, they can present with very, very atypical symptoms, not a crushing chest pain that we call a heart attack on everybody or anybody, at least suspicion of a heart attack. They can come with shortness of breath, just with some arm pain, just with some jaw pain, just with some interscapular pain in the back. Nothing, just a progressive shortness of breath. And also epigastric pain. They think it's indigestion. So women have a lot of atypical presentation, particularly if they're diabetic. And also for some reason, they don't show up to the doctors until the symptoms are really bad. That is one main thing that we focus on women, telling them that their risk of heart disease is as bad as men or even worse on men, because the presentation to the doctors is very high. By the time sometimes they show up, it's too late. Absolutely. It's even men and women, almost the preventive aspects are very similar, but they should be more aware of the atypical symptoms, particularly to make sure that they are not diabetic, that they don't smoke, they really maintain their cholesterol level very well, particularly if they have any risk factors of family disease and family history and stuff like that. And also to discuss with their OBGYN about the hormone replacement therapy and those other issues, which also sometimes are cardioprotective. So it is extremely important for them to be preventive aspects, to take care of it as much as possible, controlling the major risk factors of coronary disease, like I mentioned, hypertension, diabetes, tobacco abuse, obesity, sedentary lifestyle, and hyperlipidemia. It's a very good question. Like I said, taking the proper medications for all the preventive things that we said, talking to your primary care physicians about your really controlling guideline-directed therapies to all these major risk factors I talked to you about, taking the blood pressure medication, taking the diabetic medication, taking the cholesterol medication, not smoking, every time at least 30 minutes of exercise, at least 3 times a week is extremely important. On top of it, doctor's visits, if there is any change in your symptoms of, like what I mentioned, some atypical symptoms which is happening, particularly you have much risk factors, so that you could go and have some kind of screening workup, like a stress test, getting an EKG, and those kind of simple things. Have your lab work done first. And then if we detect and if we have an abnormal stress test or something abnormal in the EKG, to proceed to major other issues, to having a heart catheterization done, having an intervention done. After that, taking care of yourself, going into cardiac rehab, doing the exercises, following up with your doctors regularly. Compliant with the medications is the key for anybody to be keeping themselves healthy. Like I said, keeping the heart muscle strong, irrespective of having a heart attack, is the key to anybody for a longer, better life. We are so lucky in this country that there are so many available facilities are there, but a lot of other places don't have that. Because I know that, because I go and do the mission every year into remote places in India and stuff where they have nothing and they don't have any facilities. Here we have wonderful facilities available, particularly in Trinity here. It's almost like we can do anything at this point, starting from heart attacks to valvular diseases, problems with the conduction systems. We have specialists in every field available here. So make use of the facility that is available to you, to starting with the preventive care, then following up with the follow-up care to have a healthy living and a healthy heart.